CGTN, China Global Television Network.
The year 2020 will go down in infamy as the year the world shut down. The devastating effects of the coronavirus pandemic sent and continues to send ripples across the globe, touching on every aspect of our lives. However, we as a worldwide population came together and responded to fight this scourge globally as one. But because COVID-19 dominated so much of our lives in the past year, other challenges that the continent was facing were left behind. Let's take a look back now at the year that was 2020 and explore some of the key issues that impacted Africa. I'm Beatrice Marshall. Welcome to Talk Africa. The beginning of 2020 ushered in a new decade full of renewed hope for the global community. Little did we know it would turn out to be one of the most challenging years in human history. The coronavirus pandemic dominated not only the news, but has also claimed well over 1 million lives globally. It also disrupted everything else across the world, from travel and trade to education, and had a devastating impact on businesses and jobs. But Africa had other challenges as well. In addition to the corona pandemic, Africa's healthcare systems still face the ongoing problem of HIV, AIDS, and malaria, which jointly claimed more lives than the COVID pandemic across the continent. The worst locust invasion in decades descended on East Africa in 2020 and still continues across the region. It has put millions at risk of food insecurity. Climate change has also put millions at risk on the continent. Changing weather patterns led to increased temperatures and ocean levels, resulting in flooding and drought across the continent. However, despite all the challenges of 2020, we as Africans are resilient and continue to find ways to face and overcome these obstacles. Well, joining me now to look back at the year we shut down, Dr. Meshach Ruwende. He's a doctor at the Mpilo Central Hospital in Zimbabwe and the CEO and founder, Health and Longevity Limited. From South Africa, Dr. David Monyai, co-director, University of Johannesburg at the Confucius Institute, and in Nairobi, Ken Gishinga, chief economist at Mentoria Economics. Gentlemen, welcome to Talk Africa and thank you for joining us. 2020 has been quite an eventful year, very unexpected on many fronts. First of all, I want to hear from all of you, though, what key moments stood out for you? Dr. Ruwende.
Yes, obviously, as a health worker, the main key moment which then masked every other event of the year of 2020 was the COVID-19 pandemic. The hospitals were only attending the emergencies. What it then meant was that people were staying at home, deteriorating at home, only to be allowed in hospitals when there was now an emergency, and some of these emergencies were not reversible.
Ken Gishinja, your thoughts?
Indeed, 2020 was a year we shall never forget. Obviously, the COVID pandemic really stretched every capacity of every nation in Africa. And it was really a disaster and still remains a disaster. I think for me, as an economist, what shocked me the most was how little we could do to stimulate our economies, how little central banks did to be able to stimulate once businesses had shut down, how little central banks could do in comparison to the West. I think for me, the thinking on how do we refine our monetary policy tools to be able to deal with massive crises like COVID, I think that has to be a talking point amongst us economists.
Dr. Manyai, what key moments stood out for you in 2020?
I think this has been a distinctively different year for a number of reasons. I think COVID-19 has brought to the fore the complex nature of globalization. We have been able to see and feel through digital visuals the feeling of fellow global citizens, whether be it in China, in Italy, or now in the United States and across our continent. And in it brought that we are the same humanity, we are affected by similar pandemic and requiring cooperation. So there has been a good phenomena of that globalization. At the same time, I also noticed discontent, disunity, given the geopolitical politics driven mainly from Washington. So it has been a tough year, COVID, as well as our economies on the continent, and quite a number of other issues that has really brought us to realize the importance of cooperation on the continent.
So, Dr. Ruwende, let me come back to what all three panelists have talked about, the key moment that has defined 2020, that being the COVID pandemic. What has been the impact of the COVID pandemic, Dr. Ruwende, to the health sector in Africa in particular?
Okay, yeah, so there were so many impacts from this pandemic. Remember, as Africans, we were already struggling and battling with other diseases. And then now when this COVID-19 came in from around the mid-February, March and April, somewhere there, and then peaked around June, July, most of the governments, they then put in, enforced some movement restrictions. And now we know that we already have these diseases, people with chronic diseases like HIV, diabetes, heart problems, hypertension. Those people with chronic diseases, they always need regular checkups with their personal doctors, with the hospitals, or whoever give them a healthcare service. And those services were cut short because of those movement restrictions, to the extent that most of our patients were not accessing these medications. And remember, these are some of the diseases that people cannot live without medications. Not only that, we look at immunizations.
Right.
In Africa, because one way of preventing our people from diseases is immunizations, especially to children. And therefore, again, because of the movement restrictions, children were not getting immunizations.
Dr. Ruwende, it does seem that there was a major impact on not only just mortality and all the healthcare of the public, but overall, though, when we talk about Africa's cases, Dr. Ruwende, they're just over 2 million, very low compared to the rest of the world, even though South Africa then accounts for 60% of those numbers, of the 2 million, just over 2 million that Africa has. How is it that Africa has had far less numbers of COVID cases, despite what you're talking about as it having had a major impact on the health sector in Africa?
When we look at all the continents, we discover that Africa, there is less movement in Africa, especially talking about the intercontinental movements. And therefore, that meant that less people were coming to Africa per given time as compared to the countries like USA and the European countries. And that reduced movement generally meant that coronavirus took some time to be in Africa. And even in Africa, the movement of people intra-Africa is not as much as in other continents. So number one, there is the issue of movement, that people, they don't move as much. But also not only about cases, we also look at the deaths. The deaths, they are far much less than other continents, especially considering that there were predictions that Africa was going to suffer the most because of its poor infrastructure. But for some good reason, we were spared. And part of the reason is that we know COVID-19 affects especially the elderly people. And Africa is the youngest continent.
Ken Gishinja, of course, this COVID-19 pandemic has primarily been a health crisis, but also it has had major economic repercussions here. Give us a few of your thoughts, though. What's been the economic impact of the spread of the coronavirus, and particularly the efforts that governments have taken to stem the virus?
The restriction measures that Dr. Ruwende has talked about obviously contained movement, and that made demand for goods and services much less. So we saw a lot of businesses having to shut down, and because of that, there was a lot of job layoffs and unemployment. Now, the government did try to give some boosts. For example, here in Kenya, we saw a bit of tax cuts,
Right.
particularly on things such as income tax, corporate tax, payee tax. So what we call fiscal policy measures, which was quite good. But what I always advocated for was monetary policy stimulus, because when somebody loses a job and their income is zero, for you to give them a tax cut on their paycheck, it really does not make a significant impact to them. What I think was lacking was what is called a monetary stimulus, where really central banks boost a lot of liquidity into the system. So I think that for me was the biggest gap. But we did see some fiscal policy measures that were able to provide a bit of relief, but not to the extent that could have brought about proper recovery.
Dr. Munyae, your take though, because in your view, we've talked about the COVID being the major event. In your view, how did Africa and its leadership handle the coronavirus? Do you think enough attention and focus was put on the virus? Because you also did mention that a lot of disunity was coming out of the US at this particular time as well.
I think African continent has done extremely well in terms of managing and coordinating. I think we need to look at the efforts taken at the AU level. President Ramaphosa, as the chair of the AU, managed to coordinate fellow African leaders to ensure that there's somehow a form of coordination in buying equipments required to deal with the COVID-19. And we also have seen some movements in terms of how best to handle the and management of COVID-19 itself. As we speak, there is construction of the Africa CDC in Ethiopia, Addis Ababa, and we also have seen the impact of COVID-19 in a number of areas in our economies. We are dependent on tourism sector, the service sector. I think in countries such as South Africa and many other on the African continent, I think a lot of negative impact, I mean, we are noticing in terms of small business closing and people losing their livelihood. So the impact is not just the disease itself, it's the impact it has on the livelihood, even for those who are not affected directly by the disease. I think we're going to continue seeing this, the reversal of some of the major gains that the continent has registered in terms of dealing with poverty, alleviation of poverty in rural areas. And also the focus has always been and continue to be in urban centers with less focus on those in rural areas. So there's so much work to be done as we move forward in dealing with this as a learning cave for future pandemics that might reach our shores in future.
Ken Gishinga, the impact has not only been on the health sector alone, the economic has been massive. Africa's economic growth was at 3.4% in 2019. Now, the COVID-related challenges, of course, together with the collapse of the oil prices, has impacted African economies. Give us a projection, though. What's been the overall economic loss in numbers? What is the regional forecast for 2020?
The projections will be quite different because different countries had different containment measures. For example, here in Kenya, we are seeing a growth rate, we might contract by 1%. Uganda and Rwanda also had pretty tough containment measures, and we might see contractions there of around the same. But if you look at a country like Tanzania, that adopted a more relaxed approach to containing COVID, their economy likely is gonna be less hit. They are projecting somewhere around 5%. Obviously, their tourism sector will be hit hard because of the lack of foreign tourists. But overall, the fact that there's still a lot of activity going on. For them, it might be much less. So the proportionality of the economic impact will really be tied to how rigorous the containment measures were.
All right, we'll take a short break now, but when we come back, we'll continue to look at the year that was 2020. To stay tuned.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
Welcome back to Talk Africa. Still with me are Dr. Meshach Ruwende, Dr. David Monyai, and Ken Gishinga. We are taking a look back at the year the world shut down and also at some of the other events that impacted Africa in 2020. Ken Gishinga, Africa is likely to experience a delayed or reduced FDI as a result of other countries using their money domestically. We've seen China and Western countries aggressively, making recovery efforts for their economies, stimulating their economies. Are Africa's economic stimulus packages enough for a post-COVID recovery?
Well, indeed, the issue of stimulus has come up quite a bit. And if there was ever a year of stimulus, 2020 was it. Most African countries typically are driven by fiscal policy. So what we saw was a lot of tax cuts per se. But if you really think around what other countries were doing, it was really around monetary stimulus. This is really being able to boost liquidity into the systems. So I think the big thinking has to be, how soon can we get African central banks to really be at par with their global counterparts in China, in Japan, in the United States, to be able to use the most sophisticated tools to be able to inject liquidity, because businesses cannot operate without cash flow. So I think that has to be the talking point. When I think about the debt situation in Africa, what happened was a lot of African countries had to soak up a lot of extra debt to be able to deal with these containment issues. And that necessarily should not have been the case. So I think the big thinking is, the African central bankers really, in their convergence, in their collective wisdom, they have to do some soul searching and ask why were they not able to be able to boost the liquidity in African economies, to be able to prop up these economies. For me, that I think has to be the main question.
Dr. Monyai, we're talking containment here, and the vaccine is going to be one of the containment factors for Africa. But we are seeing a debate around global vaccine accessibility and Africa's concerns about affordability as they, recover their economies and access to vaccines. What's your thoughts there?
I think what Africa is really facing, being at the bottom of the global ladder, is being too dependent on external countries, those who produce the vaccines, and the politics of it. I think we are seeing the geopolitics of vaccines in which the most developed countries are hogging. Let's take an example, a country such as Canada, with a population that is 38 or so million people. They were able to buy ahead of time vaccines for more than 158 million people. That leaves countries such as ours on the continent without proper resources and infrastructure, and really lack of coordination at a global level, with the health organization highly politicized, coming from Washington, and President Donald Trump pulling out. So you see a lack of unity at a global level, and the continent left on its own, and you require African leaders to really do something to ensure that we manage to get vaccines, whether from the East or West, but it should have been managed in a way that there's fairness at the global level. But as it stands, those with the resources are somehow going to really survive, and those without, unfortunately, will be at the receiving end.
Dr. Ruenda, interesting discussion there on Africa's resources when it comes to availability and accessing the COVID-19 vaccine. 20% of Africans, in your view, will be able to have access to that vaccine. So what should Africa do, though, to maximize on their limited resources?
On this issue of vaccines, the little vaccines that we are going to get, the issue of equitable access to these vaccines cannot be overemphasized. The people who are supposed to be getting the vaccines should be the vulnerable groups, and the people like the frontliners, the people with risk factors, people with obesity, hypertension, heart problems, and other problems. And therefore, it is up to the role of the governments to make sure that their eligibility criteria is well clear, so that when we get these limited resources, we'll put them to good use and have the best results that we can have with those few resources.
Dr. Munyai, we saw China's response to Africa when it came to the COVID-19 pandemic. How has the China-Africa relationship evolved, though, in 2020 against the background of the pandemic and the economic meltdown?
China has done extremely well. If we should also realize 2020 is the 20th year for China-Africa Forum, and the pandemic has strengthened the relationship of the two parties on a number of issues. One, the coordination of policy. There has been discussions between African and Chinese leadership in terms of coordinating efforts to respond to the COVID. And we have seen massive injections of Chinese PPEs in terms of assisting African countries. It went beyond that China started developing its own vaccines. And while dealing with the crisis at home, it was able to guarantee those in developing countries, particularly African continent, that it will avail its own vaccine as quick as possible. I think we have seen that taking place within China, Brazil, with a shipment that has been dispatched already to Brazil. And one is expecting more of Chinese vaccines entering African continent. The other element of the relationship within the context of COVID between China and Africa is the coordination or in management of the disease. The construction of Africa's CDC that is ongoing in Ethiopia. So when we look at all these factors, I think one should and must commend the Chinese leadership and African leaders of working together and perhaps going forward. These efforts need to be channeled at a global level to respond not just to COVID, but other factors that are coming to the fore due to the pandemic.
All right, we're going to wrap up in a minute, but there has been a lot of lessons learned over 2020, quite an unexpected year all round in terms of public health, in terms of economies, and in terms of global cooperation and governance. Ken Gishinga, in terms of economies, what lessons were learned over 2020 on the economic front?
So I think moving forward, the African economies have to look at three areas. Number one is area of monetary policy. How do we upgrade our central banks to be able to perform at the levels of other central banks around the world? Number two is the issue of fiscal policy. how can we consolidate our fiscal deficits so that our debt levels do not go out of control? And number three, we need to reimagine the business models in Africa. We need to enter what I call the new economy. What we are doing right now, this is a new economy of digitization, artificial intelligence. For far too long, when we think about Africa, we think about tea and coffee and seeing wild animals. But as Dr. Monye said, it's the human capital that really matters. So how do we make our people more sophisticated? How do we start inventing things? How do we start really creating solutions for Africa? I think if we can look at those three lenses, I think we'd be in a much better place.
All right, Dr. Monyawe, in terms of global cooperation and global governance.
We need to strengthen Africa's own governance. I think we are seeing with the trade agreement that was signed in this year, this is the greatest achievement on our own continent since 1963 with the formation of the OAU. We need to go beyond the signing and deal with one of our greatest challenge in terms of implementation. We need to see more trade among ourselves, moving from 12% trade among ourselves up to 50 or 58%. I think that is going to alleviate poverty. It's going to strengthen our institutions as well as the livelihood of our people and give us a leverage as we confront external role players such as United States, China, European Union, and all other players that are coming on our continent in a coordinated and strengthened with an upper hand that as Africans, we will then also decide the rules of the game. At the moment, we are just the receivers of rules of the game made outside our own continent.
Dr. Ruwende, in terms of public health and public policy.
I think I'll put it in short term and long term. As of today, we must focus on prevention because we do not have the sophisticated machinery and infrastructure to be on treatment part. So let us dwell more on prevention. If it is coronavirus, for example, social distancing, wearing masks, always washing your hands. You don't need enforcement from the government. From here, vaccines are going to be here very soon. We need a positive mind about it. We need to equip our communities, tell them the benefits, answer their concerns. But in the long term, we also need to be involved in the studies and developments as far as the health systems are concerned. Even worldwide, we can't keep on being the receivers. For example, if it is these vaccines, then we need to make our own vaccines. We need to be the masters of our own medicines than depending on other countries. I hope the best for the future, for the Africa.
All right, gentlemen, thank you very much for that interesting conversation. And that's all we have time for this week, but thank you to my guests for their insights. Dr. Meshach Ruwende, he practices at the Mpilo Central Hospital in Zimbabwe and is the CEO and founder, Health and Longevity Limited. Dr. David Monyawe, co-director, University of Johannesburg, Confucius Institute, and Ken Gishinga, chief economist at Mentoria Economics. Remember, we'd love to hear your feedback through our social media handles on Facebook and Twitter, and you can also catch the show on our YouTube playlist. To keep the conversation going and tune in again next week for more Talk Africa. From me, Beatrice Marshall, and the team in Nairobi, stay safe, and we wish you a happy and prosperous 2021.